Welcome to JoyMed Podcast, brought to you by SafeHaven, a program of the Medical Society of Virginia. I'm Melina Davis, your host. I'm the CEO and EVP of the Medical Society of Virginia. We're thrilled to announce the launch of this new podcast series, where we'll delve deeper into the challenges faced by healthcare professionals, explore strategies for resilience, and highlight the support systems available to them. Each episode will feature expert insights, personal narratives, and practical tools to help foster a healthier, more supportive environment for our healthcare heroes. Make sure to subscribe to our podcast so you don't miss this important series, and share it with your friends and colleagues. Together, we can create a culture of care and support, ensuring that those who care for us are cared for as well. Thank you for listening, and we look forward to continuing this journey with you. Hello, and welcome to JoyMed, a podcast designed to address burnout, clinician wellness, and find solutions that brings joy back to medicine. And today, I'm just so happy to welcome two guests. We're so lucky to have Morgan McDowell, who's a nurse practitioner for Centra Urology, and Tiffany Lyttle, who's an RN and in charge of patient education and nurse wellness coordinator and ADT manager for Centra. Welcome, ladies. We're so glad to have you with us.
Thank you for having us.
Tiffany, I'm going to start with you. What is an ADT manager?
Oh, so I have the most incredible team. This is our admission, discharge, transfer team. They were actually built to help support the work of the nurse and remove some of the cognitive burden that comes along with doing admissions and discharges. They turned out to be a great support for throughput and for making sure that the patient experience was lovely, but they're also such a huge support for our nursing teams as well. And it was built mostly with retired nurses or soon to be retiring nurses, and they are excellent educators. They are just such a phenomenal group.
I love that. Do you see that the design of the program actually is infusing energy and hope into the group again?
Oh, yes. I wish you could have met my nurses that are in the ADT team. They are phenomenal, and they just bring joy. One of them, her name is Gay, and she was named, her full name is Ligaya. Her name is Gay, but she brings that happiness. And so she just wanders through the hospital, and people know where she is. Everyone looks for her, because if she is not cooking for us, she is just has the biggest smile on her face.
It's so nice to have personalities like that in the workplace, isn't it? It just sort of lifts everything. I love it. Well, I want to start with you, Morgan, too, to just say, what drove you to be an NP? Help us understand who you are and why you do this.
That's so fun, because Tiffany and I actually kind of went through that whole story on the way up here to Richmond today. So an undergraduate, I was pre-med like a lot of us were, right? I got a degree in biology right here in Richmond at BCU. And I got a really great opportunity to shadow. I shadowed an OBGYN. Mm-hmm. I shadowed a nurse midwife, and then I finally ended up shadowing a women's health nurse practitioner. And I was like, you know what, this is the job for me. I want to educate and empower women in their health and their wellness. And I was sold. I think that's what I wanted to do.
What was it about her that really excited you and what she did?
I think for me, it was just she got the opportunity to really sit and connect with her patients. She empowered them. And it was just amazing to see that light bulb moment with a patient when you really get them to either understand their medical condition or just share them, right? Because so often women aren't heard in medicine.
No doubt about that. That's wonderful. Tiffany, what about you? What do you love about your work, and why'd you get into it?
I actually became a nurse because I adopted a little girl who had a lot of rare medical issues. And I wanted to make sure, I was a mental health counselor at the time, and I could really support her with the mental health aspect. It was the medical aspect that I just couldn't. And, they go hand in hand. So yes. I went back to school and became a nurse. I ended up with 7 children at the end of it.
7 children?
Yes. Wow. I graduated nursing school with 7 children and started with 2. So it was an incredible journey. But, I just love being a nurse. I never knew that I would have loved it so much, and I do.
Oh, it makes me so happy to hear. What's the stark difference? What's the biggest difference between nursing and being a mental health care provider?
I would say being a nurse is far more holistic. As a mental health counselor, I can take care of the mental health portion, but I was not well equipped to talk about how medications would affect your body or how staying healthy actually is really mental health, the foundation of mental health. So I was able to do only a certain portion, and that's not holistic. And of course, we want to be far more holistic because people can participate in a full journey towards well-being.
I love that. So, Morgan, how long have you been a nurse practitioner? And you do this with urology primarily at this stage, right?
Yeah, I had a very short stint in primary care right out of school, and they told us straight up, right, like that first job right out of school, if you're not well supported, if you're not in love with it, if you're, being a new APP in healthcare is incredibly difficult. You've got to have fantastic physician mentors. You've got to have a team helping educate you the rest of the way. It was not a great experience. So I ended up leaving in that first year, and I had found fantastic mentorship with urology, great docs, great office management team, and I've been there almost 9 years.
Oh,
it's been awesome.
Nice. That's so nice. It's so interesting. Centra was the first SafeHaven provider and adopter in the country. They've been a great, great partner, and they've been a leader. How's that experience with SafeHaven in the culture? Has that affected you? Have you seen that at work?
I think so, because in my other hat, and Tiffany knows this, I'm the director of APP education. And so through that role, I'm actually one of our wellness coordinators through Vital Work Life. And it's been huge, right? Knowing that our physicians and APPs have a completely confidential, protected resource for their mental health and well-being really, I think, just lifts the load for a lot of folks.
I love it. It's been so special an experience because we came up with the idea and then we passed the legislation in Virginia. We were so lucky to find the great partnership we did with Vital Work Life. And then that Centra, really, it was just post-pandemic, which really meant we were all still going through it.
Oh, absolutely.
But they were quick to say, let's start with a small group and try, and quickly expanded and have been advocates ever since. It's just we learn a lot from Centra, and they've been a great innovation partner in this space.
It's been awesome. I love the peer coaching. We have a lot of utilization of that. We have a clinician leadership program, and it's actually embedded in that. Those folks, as they're growing through their leadership and trying to grow in that way, they get a peer coach through Vital Work Life, and it's fantastic. And they can go back again and again as they need it.
That's great. It's so interesting because burnout is something we talk about all the time in our workplaces now, particularly in healthcare. But it's not often that we get to talk about all the good, positive resources that are available that people are using. In other environments, it can be something people hide from. So it's fun that you all talk about it and it's part of your normal life. What about you, Tiffany? How is burnout addressed where you are?
We actually have a fantastic, innovative nurse leader that was at Centra at the time. She really saw the vision for how burnout was going to impact our nursing teams at some point, not only in the wake of the pandemic, but also even before. If you look at all the research before 2019, we can talk about that later, but there's a lot going on in the spaces of burnout, not necessarily in well-being. So she found, I had just done a study with our nursing teams. It was during the second surge of COVID. And we talked about in the survey how much our nursing teams were taking advantage of the resources that we had at Centra. Mm-hmm. At the time, we did not have Vital Life there. Mm-hmm. We had EAP, we had some group opportunities, and we had some education. And while these were absolutely offered, our nursing teams were not taking advantage of it, but they were still reporting symptoms of PTSD, PTSS, and of course, burnout. Yes. So we published that, and this leader that was there at the time said, we really need to create a space for wellness for our nursing teams here at Centra. And so she did. She got that job approved, and it would have been the only job I ever would have left bedside for.
Oh my goodness. What is it that is so invigorating and helpful, do you think, that would inspire you that much, especially given everything you shared about why nursing is so important?
Nursing is so important. And, when we have brand new nurses leaving the profession altogether at a rate of 1 in 3, we have to do something to protect that because we can't possibly sustain healthcare without our nursing teams. Absolutely. And they are that conduit of healthcare and understanding policy and community, being able to speak that language to somebody who is hurting or in pain or, not well. Nursing really is the adapter piece for, our community who needs healthcare and the healthcare that is provided. So,
well, people love nurses so much. I mean, you make all the difference during really difficult times in people's lives. It's such an important thing. What's a typical frontline day like in your world? I'll start with you, Tiffany. What does that look like?
I always talked about how being neurodivergent and being ADHD was actually a help because you are spinning plates from a 12-hour day, which, is not typically a healthy shift. And that's something we need to work on. But typically our nurses will work 3 12-hour shifts in a row. And that is considered full-time. So you have a 12-hour shift that starts at 6:45 and goes until about 7:15. So it's a little bit more than that. From the minute you get there, you're getting full report on the patients that you will be taking care of that day. And you start, and that person is your everything. So you will have anywhere from, 1 to 2 on an ICU, 4 to 6 on a progressive care, and then so on. We get 7 to 8 sometimes on a med surg. But every single one of those people is your priority and is your person. You're here to take care of them. Make sure you can see everything that might come and hurt that patient, every barrier that might be to their well-being, and everything that they need to be educated on. And so you are walking into one room and potentially you could be taking care of someone in their last moments. And in the next 30 seconds, you have to turn everything around and you have to be in the appropriate space to take care of that next person. That is while you're also documenting, while you're also getting several phone calls from the lab, the pharmacy, the physicians, and from management. And this is also while you're trying to make sure that you're documenting everything that everybody ate and you had eyes on every single person. Make sure that they're all sitting up and ready for their day, making sure you're documenting every single elimination that happened. So there's a lot of documentation, there's a lot of communication, and then you're also coordinating with agencies outside of the hospital, making sure that where they go, that they're also going to be healthy and taken care of. So you're making sure you're calling report, making sure that the right follow-up appointments are made, making sure that the person that's being admitted while you're also discharging this person is also getting everything they need and they know how to be safe when in the hospital, because it is a very strange environment.
It is. There's a lot going on, a lot of moving parts.
Yeah, there's a lot of moving parts.
What's the most rewarding part of a day like that?
The most rewarding part of a day like that is either with your team, and I think there's actually there is a study done for nurses across the country that has demonstrated this too. It's through the American Nurses Foundation. They put out a Pulse of the Nation's Nurses survey. And the 3 things that keep nurses within nursing are positive interactions with their patients and positive interactions with their peers. And that really is it. When you get that validation from a peer saying, thank you for helping me with that, that means so much. And then when you have patients that are saying like, I've never understood this before now, or thank you so much for taking care of me, that just means the world. You leave that day like you have just climbed the top of a mountain.
Yeah. What about the other side? What's the hardest part or the most challenging part of a day like that?
It's probably the fear, the fear that you are not enough to take care of everybody and be everything to everybody.
That's a lot of weight, fear. Fear for other people.
Fear for other people. And then fear at the end of the day, too, is that I don't have enough of me left to be what I need to be for everyone who needs me at home, too.
Your 7 children.
Yeah.
Morgan, what about you? Talk about a day in your life and what it's like.
So for urology clinic, we're a standard Monday through Friday operation, but we have full call service, so it can get a little hairy. So in clinic, as a nurse practitioner there, I'm going to see anywhere from 16 to 18 patients in a day. There are constant interruptions, right? You got to be able to turn stuff on and off pretty easily, whether you're walking in a room, triage is messaging you about a patient who needs to get in quick, fast, and in a hurry. Refills that need to go out. Your nurse has a question about what to do next for a patient that they're doing intake with. There's always something, right? And so it's just important to go in the room, try and shut out all the other noise and really give that patient your undivided attention. Because it is scary to be at the doctor's office, right? Like maybe it's a kidney stone, maybe you're concerned that you have cancer. These are big, scary things for folks. And it's really the best part of the job is to lean into that and be there for them.
Yeah, because people don't just walk into a urology office for no reason.
You're not coming because you want to be there, right? Like, that's the thing. No one wants to come to the urology clinic.
Yes. And what's the difference between your role as a nurse practitioner and one of the nurses that work there?
The biggest thing is just our education and our certification and our scope of practice. But, we don't actually have a lot of RNs in our clinic. We mostly have LPNs and MAs that work in our clinic. And the biggest thing, and my big plug for folks to go back to school to become an RN from that LPN level, is that critical thinking skill. Our RNs are so good at critical thinking, and it's such a needed skill. That kind of if then what, I'm assessing my patient and there's a change, what happens next, or what can I think about that could happen next? So I have to be the one to kind of make that decision of, if this happens, this is what we're going to do, and kind of lead that team. And I've worked with my nurse for a long time. She's excellent. She goes above and beyond. But we're a team in terms of taking care of our patients.
Yes. And so is that the most challenging thing, or are there other things that can be weighty and difficult?
Oh, gosh. In outpatient world, there's so many things we could talk about, right? I think time is a big thing. Patients want more time. We have limited time to get folks in and out of the office to be seen. Insurance and authorization. I can't always get my patients the medicine that I think is the healthiest and safest for them, considering their age and their comorbidities.
Because the insurance company won't approve them.
Right. Or it's not in a tier that's now affordable for that patient. Maybe it's a tier 4 drug, but it's the safest for that patient considering their advanced age. But Medicare doesn't really seem to sometimes always appreciate the complexities of these medications in that way. And our community struggles with being able to afford pretty much everything in some cases. So we have a different need in Lynchburg and the surrounding areas.
Yes. What about rewarding? What gets you through the day and makes you feel like it was really worthwhile and rewarding?
It's all worth it because we're helping our patients kind of live that health and well-being, helping to educate them in ways that maybe they were unaware. But for me, it's that aha moment with my patients. When I can see that light bulb go off when I've explained something that maybe they didn't understand about the symptoms that they're having or their disease state, that is so rewarding. They feel well-loved and cared for when they understand their disease process.
Yeah. Oh, I love that. So we all hear about nursing shortages, and I know that people are leaving, but even getting people back to the profession or training up new nurses means that sometimes you don't have the resource you need, or you have to work longer or take on more patients. How is that affecting you, and how does that affect your work environment?
The nursing shortage is so important because when I describe to you our typical day, you have to pull the time from somewhere. There is not enough resources to go around. And this can result in either unhealthy staffing ratios, or it can result in having to cut that time from somewhere, which is oftentimes not the life-saving measures, but it's going to be more towards education, which is really why my ADT team was built, is because we really can't skip that piece. People are empowered through education, and that's why we have to do it. And we have to do it in a way that's understandable, because if it's not accessible or it's too much information or just, too little, we are making a sacrifice that person may not be empowered to take care of themselves when they go home. Another one of the reasons that I took on this role is because my dad, he actually passed away last year from complications of diabetes because he didn't understand. English is not his first language. And he truly did not understand what was being asked of him or what he should be doing to control it. So his understanding was that I drank less government water, which is bottled water, and I don't eat yams. And we used to play around with them. I'm like, no, you actually can eat a lot more than that. And he would say, no, everything tastes bad, because he was a chef. So his life was food, and he used to talk about how our cultures are interpreted through our food, and that's why it was so important. So now you're asking someone to sacrifice that social capital for a healthy lifestyle, and sometimes it's not a sacrifice they can make. So when we sacrifice that time on education, or we sacrifice time in trying to cut a corner somewhere, people are at risk and they are in danger. And that's not something any of us can live with. So, any type of errors that occur, from greatest to small, it's not something we can live with. That's something that is going to stick with you forever.
Yeah.
So having time is just it's a delicate balance throughout the day, and it's not something that can be sacrificed. Mm-hmm. So that's where we see the nursing shortage actually creates errors. It creates problems in time. It creates sacrifices that should never be made.
That's powerful. What about you, Morgan? Same thing? Is it time or?
Time is a big issue. I think a lot of our primary care clinics, our outpatient clinics, are working short, and it just puts stress on other people. You've already got a stressed team, a stressed network of providers, of nursing, of our triage team, the folks that answer the phone, right? That's a tough job in and of itself.
Yes.
If you can't offer a patient an appointment when they want it,
yes,
that can be a frustrating day for the person on the other line. So it's just tough. We've been working short for a long time, and I think it creates a stressful environment all the way up.
Mm-hmm. And patients get grumpy, right?
Absolutely.
Particularly if they have had to wait or they're not getting time with you. How often are patients grumpy with you or violent even? We hear stories about particularly nurses, but all people in healthcare being targets of violence and anger and frustration.
It's becoming far more commonplace. When I talked about the literature before the pandemic, all these things like biopsychosocial disturbances, thoughts of self-harm, these were all in place even before we went into a global pandemic. Mm-hmm. The only one thing that we have seen actually significantly increase, even though most of them have increased, people are far more vocal now, and talking about issues and, removing that stigma around mental health and being healthy. The one thing that we've seen increase, though, is workplace violence. And we've seen far more tragic incidences of workplace violence. Mm-hmm. And if you think about it, our nursing teams are the face of healthcare, right? Anything that gets passed along is going to be educated through them. It's going to be passed along to them. They will have talked to their provider, but oftentimes the questions then are afterwards, now that I've thought about this, what does that actually mean? What does this look like? And so being that face, even delays on the phone call, someone comes in, they can be very grumpy or they're terrified.
Yes.
And I'm not talking
both sides, right?
And I'm not talking about when it's disease process. Like if it's dementia, we know that person is scared. We know that we're not wanting to be punitive towards this person, but we see workplace violence because people have, they are stretched to their capacity. Yeah. They're encountering something fearful. They're experiencing grief for the first time or maybe for multiple times. Mm-hmm. Or something is being taken away. Some sort of livelihood or capacity is being taken away. Unfortunately, so much of that is bottled up and then it comes out. Mm-hmm. And we end up being the victims of workplace violence. And even though we understand, even when it's when it's a person, and even though it's not aimed at you, that anxiety and that residue from the experience will still stay there. And I've had actually one of my nurses talks about that openly, how it was an experience with workplace violence that actually moved her from wanting to be a floor nurse because she felt so exposed, even though this person didn't mean it. She felt exposed. She felt like she was in danger.
Yes.
And then she felt ashamed afterwards because, you live with that anxiety. Like, is everything I'm doing right? Is that person okay? Am I safe to take care of this person? You rush in wanting to save a life and then you get harmed in the process. It's almost just very contrary to everything that we believe about,
well, and you're ready to do, and all of a sudden it pulls you back.
Right.
And Morgan, you see people in pain. Real pain.
Oh, yeah, kidney stones hurt. They hurt something awful.
And pain affects people.
It does.
In a very emotional way. How is that then taken out on you and your team?
So unfortunately, it's usually the frontline staff who get it more, right? Like the nurses in the hospital. It's the folks that answer the phone. It's our check-in team because they're the first line of defense. You can't get to the back and see us unless you go through them first. So unfortunately, they experience a little bit more of that than we do. I find that our patients are less likely once they get in the room to display those behaviors with us. But it's my job as a provider or my office manager to have that conversation to say, and we can't tolerate that behavior, and we don't care who it is. You can't talk to our team that way.
Yes.
And we're not going to tolerate that behavior. And I do believe that we've had to do that more really post-COVID. There does seem to be a little bit more of that kind of behavior.
We're hearing that from all fronts. You know, we passed right after COVID the first ever legislation that really was aimed at violence in the workplace to really increase the repercussions for people who do express violence in the workplace. And now we're seeing that spread across the country. I think there's more we have to do because I don't think people understand, patients don't understand that nurses and doctors are experiencing violence at work at a higher level than police and veterans.
Which is wild to think about.
That's crazy.
It is.
And many of these are women.
OSHA's the one that put that out, and you're absolutely right. And we actually need to draw attention, too, to those vulnerable populations, even within healthcare.
Yeah.
There was a study put out that talked about those that were more likely to be silent about workplace violence tend to be identified as female or as a minority.
Yes.
Which means there's vulnerabilities even within healthcare.
Right.
And it shouldn't be a silent topic, workplace violence and the experience of workplace violence. We protect the whole team when we speak up. If I don't talk about the patient that lashed out at me and I let phlebotomy or the provider walk in after me, they're at risk.
That's right.
So it's not just about us. It's about protecting that whole team, but also identifying where there are vulnerabilities. There are reasons people don't speak up because we've had complicated histories with reporting.
Yes.
So how then do we bridge that so that everyone can be safe?
Do you feel like it's getting better and that administrators understand what you're up against and they're working to help address these kinds of issues?
I think so. We actually took our show on the road. It was me and our safety officers and the director over services, and we talked about how we were introducing a curriculum for staying safe and avoiding workplace violence. But we also talked about a rollout for a curriculum we had for if you have experienced workplace violence.
Oh, that's so great.
Yeah, it's a response. We actually bring it to you very quietly, and we equip all of our leaders with the information, and it talks about what you can expect from yourself. You're going to go home today, and maybe the adrenaline will be there. You won't feel maybe bad tonight. 3 and 5 days from now, though, you might feel anxiety. You might not be able to sleep. Maybe food doesn't taste really like it should. What should we be expecting from ourselves? And what are the limits of what we should be expecting from ourselves? And when is it time to reach out for help? We also give a process because when you're in the moment, you often forget, what are my next steps? Unless it's rote. Well, we have tons of training about how to take care of other people. We are certified to it. We're educated to it. We're trained to it.
Yes.
Maybe we went to a webinar once about how we take care of ourselves. Maybe.
Right.
So there's not a lot of education about how do we take care of ourselves, especially in light of a workplace violence issue. So we want to make sure that the steps are drawn out. First step is go take care of yourself. Go call your person. Go make sure physical and emotional harm has been taken care of. Second step is reporting. Everyone deserves the right to report, has access to reporting, and it is also creating that whole safety for the whole system.
That's right.
And then the next part is, maybe we work with our HR partners to make sure you get some time off. Do you need time? Do you need access to a counselor? Do you have the opportunity? Do you have a mentor, counselor? All these people are here to support you. So how do we take care of you?
The network. I advocate all the time, and so does anybody related to SafeHaven, that you need two sides of an equation to really be healthy, at least two sides, which is you have to advocate for your own care. Right. And you have to be willing to say, I need it. You have to be vulnerable enough and strong enough to ask for help and be ready for help. And the second is you have to be an advocate and for yourself and others in the workplace to create a healthy environment for everybody around you. Right. And that environment has a culture of help and care. Right. It's if you don't have one, you really are up against it. Really, you're stuck. And you've talked about the residue of these moments that stick with you. In many ways, you can't get the plaque out if you're not showing self-care and if the system doesn't support a day off or doesn't give you the counselors and these sorts of options, right? How important is residue after you've had a bad moment with a patient? How long do these things linger when you've had a bad moment?
Oh gosh, that can probably last longer than you realize, right? If you're not paying attention and being aware and processing appropriately, that's when folks can probably turn to things like alcohol,
right,
or something else instead of processing what they need to process. It's a tough time, and I don't think people appreciate how complex and difficult our jobs are.
Yes, they don't.
It's hard to live that every day in some places, but I do think the good outweigh the bad.
Yes. And I hear that all the time, especially I think if you're a service-oriented person and you're an achiever. It's one of the reasons you're in healthcare in your jobs, right? But it's also the exact set of circumstances that keeps you from then looking to yourself to say, what do I need? And
Right.
I might need something different on Tuesday than I needed on Monday.
And there's also a portion of that residue that I think Morgan was talking about where we are not taking care of it. And, the body's going to keep score. It's going to come out.
That's such a great way
It will
to
come
say
out.
that. Yeah.
So like I said, you will go and be one thing to one person. And within that 30 seconds, you have to walk into the next room and you've got to be everything for that person too. So we'll dust it off and pretend it's not there.
Yes.
None of us have ever wanted to hear the words. And I think this is why we have so much stigma in medicine is that maybe you're just not cut out for this. And that is so harmful for your peers or anyone to say that because that's simply not the case.
Right.
For us to say, yes, this affected me, and that is okay, and I'm perfectly cut out to be in this space.
Yes.
That is so
that
important.
self-advocacy.
Right,
Yes.
right.
Yes.
But there are times and places, and I think that's where we have gotten confusion or the lines have blurred. So yes, we have to take care of that next patient. Yes, we're going to. But after the shift is over, it is okay to take care of ourselves too. Right. It is okay to advocate for our time to be healthy. Because if we're not healthy, our patients are more at risk. Our system is more at risk. We are more at risk.
Yes. I always ask people, is burnout normalized, right? Do we just accept that burnout is part of medicine and nursing and the healthcare environment? Or can we normalize care for the people in it and the patients? Where do you think we are in that journey?
I think we have just started looking at it and taking those first steps. I think we're still in our infancy because we've not only normalized it, we've also made it a badge of honor. It's our shield, right? I've been so tough. Yes. Look at how tough I am. Look at all this that I can do and I can accomplish, and I never sleep anymore. That's not a hero. That's someone who is harming themselves.
And they're getting ready to go down a downward spiral.
And predictably, that's where it goes.
Predictably, it goes there.
But for that time, man, you're just that shining star. And we have left out that part where we can say, can you say healthy no's? Can you still accomplish everything you want to and get some sleep? Because that's okay. Yes. Yeah. Can you eat healthy? Can you take that run or do whatever it is that you love to do to work out? Can you do that after work or can you put it here or there? We have to engage in taking care of ourselves because we will not be good at caring for others if we don't.
What about you, Morgan? Where do you think we are in this journey?
We're not there yet. I think there's still a lot of work to do in this space. I try to check in with my team and say, are you eating? Are you sleeping? Like, have you had time for you? What have you done that brought you joy outside of work, right? Where are your hobbies? Yeah. And I do think your cell phones have become this saying that we're all somewhat addicted to with that quick scroll and that mindless behavior of popping back on your phone. But that probably doesn't really bring you joy, right? It's clearly doing something to all of us, but it takes away time from that hobby about reading for pleasure, doing something great with your family. So I think the healthcare systems have got to lean into this and figure out a way. How can we see patients, still have access to care, be profitable, but have a really healthy workforce?
Right. Yeah.
Right? How do you do that? Is that, there's a lot of ways to do it, and I don't know that we've figured that out yet.
Well, let's talk about that. So if I'm a person who's mentally aware and I'm a self-advocate and I consciously take part in my own care, right? Even if I'm not experiencing bad moments, have a healthy sort of mental awareness and lifestyle. What can my environment offer to me that encourages that or helps me deal with the stressors or the residue that gets stuck to me or encourages me to stay healthy? Because it is this two-sided equation, right? What can the workplace be doing to add and encourage this culture of wellness when I'm at work?
You're right.
And there's this really beautiful model. It was created by Richard Westphal at UVA called the Stress First Aid model. And it kind of gives a visual representation of what that looks like. So yes, we are operating in that area where we're healthy, but what we encounter throughout our day can create those stress injuries, right? Mm-hmm. Most of them go away at the end of the day. You know, we're stressed for that day. Now we're off and we're like, oh, we're good. Then there are days that you are just gripping the handle of your steering wheel and you have not left the parking lot yet.
Yes. Yes.
And that's sticking with you. It's that residue and those echoes that you carry with you of, you know, maybe I could have done this differently, or, you know, this shouldn't have happened, or how did this happen to this person? They end up in my hospital. Like, why weren't they helped before then? Or you're experiencing that secondary trauma of the patient that you had to take care of, that what happened to them was unreasonable. Yes. And so that carries with you. And that's where we start seeing these stress injuries, where we carry them and they stay with us. And you're right, there isn't a way for us to protect our community necessarily unless we do far more in policy and legislation. But in the workplace, do we need all the dinging bells? Do we need a full inbox? Sounds. Do you need to be able to contact me on my cell phone and Teams and overhead? And do you need all the noise? Mm-hmm. You know, it's that sacred space of being able to communicate with another person, with our peers, with our patient. We can't do that if everything is buzzing all the time. So how do we create those sacred spaces to be?
Mm-hmm. I've heard things like, do you have time to have food?
And a bathroom break.
Right? And a bathroom break. These are basic things that I don't think the public understands you don't get. Most people don't drink water or eat all day if they're in healthcare. Why is that?
That is correct.
Why? Well, I do.
Actually, there's something called nurse's bladder that I'm sure Morgan can speak to, because you aren't able to go take care of basic human functions.
Yes. And why?
I think part of it is the culture, right? Some of there's that. And then some of it's the people who want to end up working in healthcare, right? I think a lot of us are very type A. We're very driven, intelligent, capable people. But you have to pause. I tell my front lab team all the time, I'm like, self-care comes first. Stop what you're doing and go to the bathroom.
Yes.
This patient can wait 4 minutes for you to go in that room because you need to go to the bathroom. Right. And that's okay.
Right.
Or maybe you need to go fill up your coffee. Right. Or you have to step away because one of the children, the school is calling, right? We have priorities in our life, too, that have to be taken care of. And it's making that space and saying that that's okay.
And having enough staff available so that you can, as something an employer can do and a hospital can do, right?
And I think you hit on something, Morgan. I think sometimes all people need is to hear that it's okay.
Yeah. Please
because it did not register in the first place, because you see your task of things to do. Nowhere in there is saying, please go eat something.
Right. And this is all, in many ways, an extension of this concept of psychological safety, right? That it's okay. It's okay to be human. It's okay to just pay attention somewhere else, because we've got you here. We're going to cover you here so you get the moment. I think this is something that I know is an expense for systems and employers, but I think it's costing us, the humans in healthcare, if it doesn't cost us dollars. And we've got to find a solution to it.
I think we even need to look at design, too, because there's kind of this known amongst nurses is that the only thing that the patient's going to hate more than something terrible happening is seeing their nursing sitting down. They don't want to see the nurses sitting down. So it's not like you can eat in a place that's anywhere obvious. Right. Because if a family comes up, it looks like you're lazy, you're sitting, you're not doing what you're supposed to, or, so-and-so really needs you. Why are you eating? How dare you? So we almost have to look at a design, and we've done this in one of our hospitals, our flagship hospital. We've created something called the Oasis, where people can leave the unit. It's actually an outdoor space on the second floor, and the lights are on morning, noon, and night. It's actually been built in a very carbon neutral way. And we used all sorts of wonderful things in this space so our teams can leave. Yes. We had to shade the windows so that people can't see in. So you have badge access to go out to this outdoor space, and no one can see you out there, which is wonderful. because you don't get called back.
Yeah.
Now, sometimes, of course, we have to take our phones with us and we have to be available, and that's fine. But no one sees you sitting, so you don't sit there with that guilt while you're eating or while you're trying
form
to
of
just
shame,
do something.
really.
Yeah.
Right? It's a form of public shaming in a way, isn't it? You know, I'm a big advocate for teaching the public and patients how we can be more caring of the people who care for us, because we don't know. I think in order to empathize, we have to be educated. We have to understand what it is that you're up against and how we can help you, right? And what do you wish patients knew or did that would be helpful to you?
I do like the patient that comes in with their list of questions ready.
Ah, nice.
Right? You've already done some research, even though in healthcare we don't love Dr. Google, right? That comes with its own issues.
Yeah.
But I love it when patients are informed and educated about their conditions. They come in prepared to really make the most of our time together in clinic, because it is limited. Mm-hmm. And I want to get your questions answered in a timely fashion, and I want to make sure you feel good when you leave.
Mm-hmm.
So that's a helpful thing.
That is helpful.
This might sound strange, but I'll explain it. I think we need is trust. So I work a lot in our community, and what I see most of the social determinants of health, one thing that I see most that isn't really well talked about is fear. People are very afraid of healthcare. They're afraid of doctors, they're afraid of nurses, they're afraid of hospitals, clinics, all of it. They don't want to even engage, so they don't get healthcare. And when they come in, oftentimes it's so progressed, and we do a lot of work to help empower them to bring back something that maybe can't be cured at that point. So when you're talking to your physicians, when you're talking to your nurses, or they're not present or they are present, just that trust that if I'm not in the room, I am still advocating for you. Trust that I'm not trying to harm you in any way. You know, listening to my dad communicate about his nurses and his teams, it was so disheartening to me sometimes. I'm like, Dad, I am a nurse. I would never feel that way over somebody.
Yes.
You know, trust me, and trust me with what I'm telling you, that, you know, this is an iterative process. We're all learning, but we can all learn together too. Please trust me. Know that if I'm not in the room, I am advocating for you. But even if I am in the room and I'm telling you, it's the best education and information I have to give you. And we can work together. You know, you may not like it. We'll work together. Let's get to a place.
Oh, I love that. What about administrators? If you had to ask for one thing and wish that they would do something, what would it be to make burnout and wellness better in your environment? I know you guys are in a great environment, so we'll give kudos to them right away. But if you had a wish list, even if it's for other environments, what would it be?
I have a long wish list. How much time do we have?
Go.
I love the 36-4 work structure for providers, right? And outpatient, to give them time to do the wellness things, right? Give them 4 hours a week to clean the inbox, to focus in, to do their vital work-life wellness intake, and to have that time to schedule their peer coaching or counseling in those 4 hours of admin. That way they can participate in other things if they want to do research. Give folks some flexibility. What brings them joy beyond patient care? Maybe it's research, maybe it's students and teaching and stuff like that, but that's huge. The clicks, we've got the EHR.
Yes.
I can't wait for AI to be fully integrated.
Absolutely.
I know. That's the new thing right now. Not just AI, but AI to solve this paperwork problem, this documenting problem.
I want an AI for prior auths.
Yeah.
That would be huge.
Oh, that would be everything.
How much easier would that be if we could reduce just half of the alarms?
Oh, yeah.
And use the EMR as a tool and far less of a constant thing nagging you in the back of your head.
Yeah.
I mean, sometimes we need the nagging. Some of the alerts are great, but are all of them necessary?
I love that. Mm-hmm. What about for organizations like the Medical Society of Virginia or the Nursing Association? What's the one thing or two things that you would hope that we would work on next?
So I think for nursing teams, and I really do like the 36-4, I think we do need that sacred space to be able to do competencies, education, and things like research. You know, we can't advance what we're doing unless we have done the research to get there. That's part of health equity, too, is doing the research to find out the answers to the questions. We have to have that protected time. But I would also say that the pay structure that nursing is in is archaic. It was invented in the 1800s. We are still billed as room and board. We are neither furniture nor vegetable, and yet we are still billed as room and board.
That's insane.
So how can we change this and adapt for our healthcare and still be valuable to, our patients and our community, but still validating the work of the nurse and the training and the education and so much that goes into it? There's a lot of work to be done there. And, I don't think anyone has a really great concept for it yet, but there has to be movement into this space.
Mm-hmm. What about you, Morgan? Anything on your wish list for organizations like ours?
Well, I think our organizations have all done a really good job of coming together this year. MSB,
yes.
Virginia Council of NPs, BNA.
Yeah.
And I think the joint effort of advocating for all the things, right? Workplace violence, pay parity, reimbursement rates, all of this has to continue. And I think we can all do it better together.
Yes.
Yes.
And it's the message I hear most probably in the burnout conversation is patients with clinicians, clinicians with administrators, organizations across scope coming together. It's almost like we need to create more permeability between all of us and more empathy between us and more grace.
Absolutely.
Right.
What we're up against is too great for us to be fractioned, for us to be segmented off. We all have our own fights, but we're up against health equity. How are we going to take that on without all of us at the table?
Yes.
We're up against terrible things like workplace violence. How do we combat that if we're not here on the same side together? Mm-hmm. We have to be on the same side, and we have to be, pushing this forward incrementally, sometimes in waves, but we have to do it together. There's no way we can do it outside of that.
It's just important messaging, and I'm just so grateful for your wisdom and for your time today sharing with us. I just can't tell you how beneficial it's been for me to be here, and I'm sure our listeners. So thank you, Morgan. Thank you, Tiffany. I really appreciate you.
Thank you so much for having us.
Awesome. We appreciate it very much.
Thank you for listening to Joy Med, a podcast series I think you'll find very interesting and compelling, all dedicated to making our healthcare workforce healthier. Come back and hear us soon.